So I thought we'd sit down with Colleen, one of our surgery nurses, and ask her some unrehearsed questions about facelift and the recovery and all the things. Okay, so Colleen, can you describe the recovery process?
The recovery process starts in the recovery room after surgery. We do a little monitored anesthesia care, so there's no actual breathing tube placed unless that's a necessary thing for you. So I'll help recover you for about 30 minutes to an hour, get you set up with your post-op instructions with the person that comes with you, and send you home that night. Post-op day one is a pretty exciting day for us. We get to see you one day out. Just make sure that everything looks good on day one. People come in usually 3 to 4 days afterwards to have drains removed, just depending on how you're doing. And usually day 6 or 7 is when you come back in to have your stitches taken out, depending on what we did for you.
Can you talk a little bit more about pain? That's one thing that I get a lot of questions about, is how painful is a facelift?
So as the person who spends probably most of the time with these patients in the recovery room and afterwards, I don't think pain is the main thing that people really complain of. It's usually just tightness and discomfort. Sometimes they're a little bit itchy, especially if they've had a peel of some sort. But pain is typically minimal. It's highly manageable with routine Tylenol. We do call in pain medications for patients, but very rarely do they actually have to take them.
What's something that patients typically go through but maybe don't ask about before the surgery?
I think the emotional side of a facelift is something that most people don't know about unless you've actually had one. There is a very real emotional roller coaster that people go through because we're operating on your face. That's something that you see every day. It's not like we're operating on your leg or your stomach or somewhere that's kind of covered up. So there is a very real period of kind of acute depression where people wonder, what did I do? Did I make the right decision? And this is usually in the same time period where you look the worst in terms of healing. So I think it's something that most patients should be aware of. And even though we talk about it, I think it's still difficult to explain to patients until they've actually gone through it.